everyone! So this is the second part of the first video. So again, we are on the topic of acceptance and commitment therapy, ACT. And if you have not watched the first part of this video, I would suggest you go watch that because it will be a continuation from what we are going to discuss today. So today we're going to take a step further and we're going to discuss about self-doubt, how it can be beneficial or detrimental, and if it does produce negative consequences, how you can overcome a high self-doubt. We're also going to discuss about persistent emotional pain, and we're also going to discuss about the key processes that you use when you think about events or experiences or about negative feelings from the past. To conclude, I'm also going to give you a metaphor that ACT proposes, and it has shown to be very beneficial to clients because it helps them understand how their thinking patterns might be like and how negative thinking can lead to negative consequences. Okay, so let's begin. What is self-doubt? Well, self-doubt is a natural occurrence. It can actually happen on a weekly basis, and sometimes it can be very beneficial. It can be beneficial because if you do not have a self-doubt, if you do not take a step back and think of your choices, then you might be more impulsive, and that will lead to reckless behavior. And that's the last thing that we would want. So, self-doubt is the uncertainty that you might have about your abilities, about your potential successes, or about your competencies. As I said, if you have some self-doubt, that's good. However, if the self-doubt is persistent, then it will lead to some negative consequences. So, high self-doubt can lead to always questioning whether you're making the right decision, whether I should apply, let's say, for that job. Am I good enough? Should I talk to that person? Should I befriend that person? Or will they think that I'm not good enough or I'm not funny enough? So it will keep you from living certain experiences, so you will not be able to express your true self. ACT views high self-doubt as a component of self-criticism and low self-esteem. What is important to mention here is that high self-doubt can also lead to other physiological and psychological issues. And physiological and psychological issues can both be felt equally strong. Another thing that I need to stress here is that when you have high self-doubt, you will also have the persistent need of reassurance from others. So you will always feel that you need to ask other people about whether you should go ahead with that job opportunity or which decision is the best one to make. And that will be maybe annoying to other people, but also to yourself, because you will always feel this need to ask others about their opinion, and will also be very draining, very tiring. The key thing here is that you will also be sending the message internally that I need to ask someone else for their opinion because I cannot trust myself. I should not trust myself of making this decision because I will not be the right person to make this decision. So how can we overcome this high self-doubt? Well, first of all, you can perform ACT strategies and become aware of them, accept them, and hopefully be open to the possibility that they can come and go, just like clouds in the sky, as we said in the first part of the video. So you are open to the possibility that they exist. The second option is that you can perform more of cognitive behavioral therapy, and you can think of the thoughts either as rational or irrational and bring in the evidence and whether they are now realistic or not. Are they rational or not? So that's the second option that you could make. The third one is to lower your expectations and standards. And by that, I don't mean to not aim high. I mean, some people might have the all or nothing thinking that if I do not succeed in this, then that's it, I'm never going to try, it's pointless. And by lowering your expectations, what you will do is that you will think that I might succeed, I might not succeed, but what will happen is that I will definitely enjoy the whole process. I will enjoy it whatever happens. So that will help you, that will motivate you to take action instead of waiting to hear from someone else on whether you should be making that decision. So that's what self-doubt is and how you could overcome it. So let's move on to emotional pain and what happens when it is persistent. So emotions are electrochemical signals flowing in your body, and they're actually the natural occurrence that can happen when you're interacting with your environment. When you're socializing with different people or you're experiencing different situations, different events, you might feel happy, sad, angry, many different emotions. But what happens when you have a persistent negative emotion? What you will be experiencing is what we call emotional pain. Some people will resort to activities like drinking or drug abuse or even self-harm. So this is because they want to escape this ongoing emotional struggle. What ACT teaches you is that actually emotions are neither good nor bad, and it's us who are going to label the emotion. The emotion will also result from your personal interpretation of the event. And this is why some events might be felt more intensely by some people, whereas by others they might not mean so much. So what ACT is also going to teach you, as we also discussed in the first part of this video, is that the psychological suffering, the emotional pain, might be part of your everyday life. And you can let it run in the background while you continue with your activities. So you become the observing self, and instead of engaging with your thoughts and think of why am I having this emotional struggle right now, you let it just run in the background and you keep on continuing with what it is that you are doing. So they're just like clouds in the sky, and you will become the observing self and say, I'm now noticing that I'm angry or that I'm sad. What it is important is that you're also, as a therapist, will normalize this emotion with your client. And your client will feel great relief when they hear that actually, considering what it is that you have been experiencing, those emotions are not abnormal. They are normal. And as I said, it will be a great relief to your client. I'm not saying that by saying that they're normal, you will tell them that you should be continuing like that. No, what I'm saying is that together with your client, you can discuss why it can lead to maladaptive thinking, to behavior that can lead to negative emotions, and together you commit to a behavioral change, to a behavioral change that can also change your thinking patterns and hopefully your emotions. So let's move on now to how you can deal with things from the past. I know that most of us have experienced this idea of thinking over and over again about what we could have changed, what we could have said, what we could have done in the past, whether we made the right choice or not. And we keep on thinking, if we could turn back time, this is what I would have done. But what that will create is that you're stuck in the past and you're actually not performing mindfulness. You're missing on what the present has to offer you because you're always thinking about the past experiences and how that made you feel. When you're doing that, you're using two processes. One of them is introspection. So introspection is when you are trying to become curious, when you are self-exploring about things that happened in the past and you try to draw lessons from the past. So you want to draw conclusions and hopefully you can keep that and not to perform the same mistake in the future. So it can bring nostalgia, but overall the outcome will be a positive one because you're drawing from your past and you're bringing that positive awareness into the present. The second process is rumination, and actually this mental activity is based on regrets. This is when you are overthinking, you're thinking over and over again, and you're going in loops about what you could have done, what you should have said, and what it will create is actually no self-exploration. You are not a curious self that tries to learn from the past. You're just the person that tries to think what I could have said, and that is actually a bit of waste of time, and it will make you tired a lot. So those are the two key processes that we're going to use when we think about the past and what we could have changed. Moving on to the last part of this video, I'm going to bring in a metaphor that you can use with your own clients, and it's what we call passengers on the bus. So this metaphor is actually very enjoyable. I always try to use it with my clients, and it has also had a very positive effect on me personally. So passengers on the bus. The passengers are actually the thoughts, your emotions, your memories, or even your mental images. The bus driver is the rational self that you are having, and the bus route is actually your life experiences, the choices, or even your weekly experiences. So passengers will come on and off the bus, and what sometimes they will try to do is interact with the bus driver. So passengers are actually distractions to the bus driver. Now, what happens when the bus driver wants to change the route and wants to take a different turn? What will happen is that the passengers might start chattering, and they might even name call the bus driver, and they might say like, don't do that, remember the last time that you tried that, and don't do that again, it's scary, it's unfamiliar, you failed last time. You might start name calling them like you're stupid, so things like that. Or you might be more quiet, but again judgmental, that you shouldn't try that, you should be more cautious because from last time you saw that you were not so good enough. So those are some of the things that the passengers might say to the bus driver. The bus driver might always have this need to interact with the passengers because it's not easy to hear that someone else is name calling you or someone else is doubting you and you just continue your route. But this is exactly what you should be doing, because the passengers might be the distraction and they might even be shouting and trying to be as loud as they can, but the driver is the person who has the power, because he is going to be the person who drives the bus. So what you can do is, of course, you cannot tell them to leave the bus, or you cannot try to eliminate the passengers. But what you can do is just let them be, and as I said in the previous part of this video, you can just let them run in the background. You can just let them scream and shout and name call, although I know that it's very difficult not to interact with them. You can just let them be part of your background of your bus, and instead you are going to continue with your own route because you are the person who is driving the bus. You are having the power and control of your own life. So that can be one way that you can think about it next time that you are having those thoughts of, should I do that? Should I not? I remember that time that that happened, and I'm not going to take this different life choice this time, or I might not change the career, or I might not do this big change in my life because it's unfamiliar and it's scary. So hopefully you can use that metaphor when something similar comes into your mind, into your life. So that's it for today, guys. This is the end of this second part of this video and the end of our topic on acceptance and commitment therapy. I hope you found it useful. You can view both parts of the video, and hopefully it can help you if you are a therapist to use those techniques with your clients, or if you are just an individual who is interested in ACT, it's something that you can find useful. In this second part, we talked about self-doubt. We also brought some ways that you can overcome self-doubt, and then we talked about emotional pain and what happens when it is persistent. I also talked about the key processes that you're going to use when you are thinking about events or experiences from the past. And in the end, we also discussed about a metaphor that I really enjoy, the passengers on the bus. So that's it for today. Thank you very much for watching.